Anxiety is a natural response to stress and a normal part of life, often characterized by feelings of unease, worry, or fear. It can become a clinical disorder when these feelings are excessive, persistent, and interfere with daily functioning, leading to conditions like generalized anxiety disorder, social anxiety disorder, or panic disorder. Anxiety can manifest physically, mentally, and emotionally, affecting both the body and mind. Anxiety can be debilitating. It includes symptoms such as excessive worry, restlessness, muscle tension. This can impact daily life, relationships, and overall well-being. Types of anxiety. First, generalized anxiety disorder, GAD. Generalized anxiety disorder is characterized by excessive and persistent worry and anxiety about various aspects of life, even when there is little or no reason for concern. It often involves excessive concern over health, finances, work, and relationships. Symptoms include constant worrying, restlessness, muscle tension, irritability, fatigue, and difficulty concentrating. Symptoms typically persist for at least 6 months. Second, social anxiety disorder, social phobia. Social anxiety disorder, or social phobia, involves an intense fear of social situations and scrutiny by others. Individuals with this disorder often avoid social gatherings or endure them with extreme discomfort. Symptoms include fear of humiliation or embarrassment, blushing, sweating, trembling, and avoidance of social situations. Symptoms typically last for 6 months or longer and can significantly impact daily life. Third, panic disorder. Panic disorder is characterized by recurrent and unexpected panic attacks. These attacks are sudden and intense, often peaking within minutes, and can lead to a fear of having future panic attacks. Symptoms include rapid heartbeat, shortness of breath, chest pain, dizziness, sweating, and a sense of impending doom or loss of control. Panic attacks can occur suddenly and may lead to the development of the disorder over time. Fourth, specific phobias. Specific phobias involve intense, irrational fears of specific objects, situations, or activities. These fears can lead to avoidance behavior. Symptoms include anxiety and fear when confronted with the specific phobic trigger, avoidance of the trigger, and distress at the thought of encountering it. The duration can vary depending on the individual, but typically persists over time without treatment. Fifth, obsessive-compulsive disorder, OCD. OCD is characterized by intrusive, distressing thoughts, obsessions, and repetitive ritualistic behaviors or mental acts, compulsions, performed to alleviate anxiety. Obsessions can include fears of contamination, harm to oneself or others, or doubts. Compulsions may involve excessive hand-washing, checking, or counting. Symptoms are chronic and can significantly disrupt daily life. Sixth, post-traumatic stress disorder, PTSD. PTSD develops after exposure to a traumatic event and involves symptoms such as intrusive memories, nightmares, hypervigilance, and avoidance of reminders of the trauma. Symptoms include re-experiencing the traumatic event, emotional numbing, irritability, and difficulties with concentration and sleep. Symptoms can persist for months or years and may require treatment for recovery. Seventh, separation anxiety disorder. Separation anxiety disorder typically occurs in children and involves excessive fear or worry about separation from caregivers or loved ones. Symptoms include fear of being alone, nightmares about separation, physical symptoms when separated, and reluctance to attend school or leave home, persistent for at least 4 weeks in children and adolescents. These are some of the primary types of anxiety disorders, each with its unique features and characteristics. It's important to recognize that anxiety disorders can vary in severity and may co-occur with other mental health conditions. Seeking professional help is essential for accurate diagnosis and effective treatment of anxiety disorders. Causes and triggers. What causes anxiety? We'll discuss the interplay of genetic, environmental, and psychological factors, as well as common triggers that can exacerbate anxiety symptoms. First, genetic factors. Genetics can contribute to a predisposition for anxiety disorders. Some individuals may have a genetic vulnerability to anxiety, meaning that they are more likely to develop an anxiety disorder if it runs in their family. Specific genes and genetic variations can play a role in regulating brain chemistry and the body's stress response. Second, brain chemistry and neurotransmitters. Imbalances in neurotransmitters like serotonin, GABA, gamma-aminobutyric acid, and norepinephrine can lead to anxiety. These neurotransmitters play crucial roles in regulating mood and anxiety. When their balance is disrupted, it can result in heightened anxiety and stress responses. Third, environmental factors. Life experiences and environmental stressors can contribute to the development of anxiety. Exposure to chronic stress, trauma, or adverse life events can increase the risk of developing anxiety disorders. High-stress environments, such as a demanding job or living in a violent neighborhood, can also be contributing factors. Fourth, childhood experiences. Early childhood experiences and attachment patterns can influence anxiety. Insecure attachment to caregivers or exposure to childhood trauma can impact emotional regulation and increase vulnerability to anxiety in adulthood. Fifth, personality traits. Certain personality traits, such as perfectionism or neuroticism, can contribute to anxiety. Individuals with perfectionistic tendencies may experience anxiety related to fear of failure or not meeting their high standards. Neuroticism is characterized by heightened emotional reactivity and may predispose individuals to anxiety. Sixth, medical conditions. Certain medical conditions can trigger or exacerbate anxiety. Conditions like heart disease, thyroid disorders, and chronic pain can lead to symptoms of anxiety. Additionally, side effects of medications or substance withdrawal can mimic anxiety symptoms. Seventh, substance abuse and withdrawal. Substance abuse, including alcohol, drugs, and caffeine, can trigger or worsen anxiety. Substances like alcohol and stimulants can lead to anxiety symptoms when used or abused. Additionally, withdrawal from substances like benzodiazepines or opioids can result in severe anxiety. Eighth, major life transitions. Significant life changes such as marriage, divorce, relocation, or job loss can be anxiety triggers. Change and uncertainty can increase stress levels and trigger anxiety. The adjustment period during major life transitions can be challenging. Ninth, trauma and PTSD. Exposure to trauma or a traumatic event can lead to post-traumatic stress disorder, PTSD, and severe anxiety. Trauma, such as physical or sexual assault, combat experiences, or natural disasters, can have lasting effects on mental health and result in persistent anxiety symptoms. 10th, social and performance situations. For some individuals, specific social or performance situations can trigger anxiety. Social anxiety disorder, for example, is characterized by intense anxiety in social situations. Similarly, performance anxiety may occur in contexts like public speaking or artistic performances. Understanding these causes and triggers of anxiety is crucial for recognizing and managing the condition. It's important to remember that anxiety can affect individuals differently, and treatment approaches should be tailored to each person's unique circumstances and needs. Treatments for anxiety. First, psychotherapy, talk therapy. This includes A. Cognitive behavioral therapy, CBT. CBT helps individuals identify and challenge irrational thoughts and behaviors that contribute to anxiety. It provides practical strategies to manage anxiety effectively. B. Exposure therapy. This technique gradually exposes individuals to the situations or objects they fear, helping them build tolerance and reduce anxiety responses. C. Mindfulness-based therapies. Mindfulness-based approaches such as mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT, teach individuals to stay present and reduce excessive worry. Second, medication, A. Antidepressants. Certain antidepressants such as SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, are also effective in treating anxiety disorders. B. Benzodiazepines. These medications may be prescribed for short-term relief of severe anxiety, but are typically not recommended for long-term use due to the risk of dependence. The information provided here is for educational purposes only and should not be considered medical advice. Consult a healthcare professional for personalized guidance on medication, including antidepressants and benzodiazepines, tailored to your specific needs and conditions. Third, alternative therapies. A. Biofeedback. Biofeedback techniques help individuals gain control over physiological responses to stress and anxiety, such as heart rate and muscle tension. B. Herbal remedies and supplements. Some people find relief with herbal supplements like St. John's wort or supplements like magnesium, but it's essential to consult a healthcare professional before using them. Coping strategies for anxiety. Breathing exercises. Practice deep breathing exercises to calm the body's stress response. Slow, deep breaths can help reduce feelings of anxiety. Progressive muscle relaxation. Learn and practice progressive muscle relaxation techniques to release physical tension associated with anxiety. Mindfulness and meditation. Engage in mindfulness meditation to stay present, reduce rumination, and manage anxious thoughts and sensations. Physical activity. Regular physical exercise can boost mood and reduce anxiety. Activities like walking, jogging, yoga, and Tai Chi can be especially helpful. Healthy diet. Maintain a balanced diet rich in whole foods, including fruits, vegetables, and whole grains. Limit caffeine and sugar intake, as they can exacerbate anxiety. Adequate sleep. Prioritize getting enough sleep, as sleep deprivation can increase anxiety symptoms. Limit stressors. Identify and manage sources of stress in your life. Delegate tasks, set boundaries, and practice time management. Positive self-talk. Challenge negative or catastrophic thinking patterns by replacing them with more realistic and positive thoughts. Journaling. Keep a journal to record anxious thoughts and emotions. This can help you gain insights into your triggers and thought patterns. Support system. Lean on friends and family for support. Sharing your feelings and experiences can provide emotional relief. Professional help. Consult with a mental health professional for guidance and therapy tailored to your specific anxiety disorder. Self-help resources. Access self-help books, apps, and online resources that provide strategies and information about anxiety management. Remember that effective anxiety management often involves a combination of treatment approaches and coping strategies. It's essential to work with a mental health professional to develop a personalized plan that best suits your needs. Reaching out for help and support is a crucial step in managing anxiety effectively.